Chapter 14, the Skeletal System, Part 6. Joints. Joints or articulations are locations at which bones of the skeleton connect with one another. Most joints, but not all, are structured in such a way that they allow movement. Of joints that do allow movement, the extent, direction of the movement that they allow also varies. The extent and direction may also vary. Classification of joints. The structural classification of joints depends on how the bones connect to each other, and the functional classification depends on the nature of the movement. There is significant overlap between the two types of classifications because function largely depends on the structure. Structural classification of joints. The structural classification is based on the type of tissue that binds the bones to each other at the joint. There are three types of joints in the structural classification. Fibrous joints are joints in which bones are joined by dense connective tissue that is rich in collagen fibers. These joints are also called sutures. The joints between the bones of the cranium are fibrous joints. Cartilaginous joints are ones in which bones are joined by cartilage. The joints between most of the vertebrae in the spine are cartilaginous joints. Synovial joints are characterized by a fluid-filled space called a synovial cavity between the bones of the joints. The cavity is enclosed by a membrane and filled with a fluid called synovial fluid, which provides extra cushioning to the ends of the bones. Cartilage covers the articulating surfaces of the two bones, but the bones are held together by ligaments. The knee is a synovial joint. So you can see how we have that, the capsule filled with fluid, and then we have the articular cartilage, the shiny type of hyaline cartilage that provides the smooth movement. And some of you might be familiar with wear and tear on this joint as the cartilage and the fluid diminish. Functional classification of joints. The functional classification is based on the type and degree of movement. There are three types of joints in the functional classification. Immovable joints allow little or no movement at the joint. Most immovable joints are fibrous joints. Besides the bones of the cranium, immovable joints include joints between the tibia and fibula in the lower leg and between the radius and ulna in the lower arm. Partly movable joints permit a slight movement. Most partly movable joints are cartilaginous joints. Besides the joints between vertebrae, they include the joints between the ribs and sternum. Movable joints allow bones to move freely. All movable joints are synovial joints. Besides the knee, they include the shoulder, hip, and elbow. Movable joints are the most common type of joint in the body. So here we have all the joints, 6 classes: pivot, hinge, saddle, plane, condyloid, and ball and socket. A pivot joint allows one bone to rotate around another. An example of the pivot joint is the joint between the first 2 vertebrae in the spine. This joint allows the head to rotate from left to right. A hinge joint allows back and forth movement like the hinge of a door. An example of the hinge joint is the elbow. This joint allows the arm to bend back and forth. A saddle joint allows 2 different types of movement. An example of a saddle joint is the joint between the first metacarpal bone in the hand and one of the carpal bones in the wrist. This joint allows the thumb to move toward and away from the index finger and also to cross over the palm toward the little finger. A plane joint, also called a gliding joint, allows 2 bones that glide over one another. The joints between the tarsals in the ankle and between the carpals in the wrist are mainly gliding joints. In the wrist, this type of joint allows the hand to be bent upward and the wrist to also wave from side to side while the lower arm is held steady. A condyloid joint is one in which an oval-shaped head on one bone moves in an elliptical cavity in another bone, allowing movement in all directions except rotation around an axis. The joint between the radius in the lower arm and carpal bones of the wrist is a condyloid joint, as is the joint at the base of the index finger. A ball and socket joint allows the greatest range of movement of any movable joint. It allows forward and backward as well as upward and downward motions. It is also allows rotation in a circle. The hip and shoulder are the only two ball and socket joints in the human body.